Good afternoon, fellow Rotarians. I'm Ruth Shelley, President of the Rotary Club of Portland. Welcome to our live weekly membership meeting. And welcome especially today after snow and ice and power and internet outages. The fact that you made it today means more than I can say. Rotarians are resilient, if nothing else. Now, every meeting I've opened with this year's theme, Rotary Opens Opportunities. Yes, Rotary opens opportunities to find solutions for today's challenges. Healing from the pandemic, recovery from the economic downturn, and peace building as we seek racial justice. This week we focus on door number 1, healing, as we hear Dr. TerMeer tell us about the Cascade AIDS Project. But first, let's welcome Rotarian John White for our reflection. John?
Good morning, Rotarians. For the last 6 years, your club has led a literacy project in Paraguay. It is a country, especially in the rural areas, where kids are taught by rote memorization. Few come out functionally literate. That is, they don't understand what they read. In these 6 years, we have retrained about 2,000 teachers to use modern teaching techniques that so far has improved comprehension for about 100,000 children. During 2020, while schools were mostly closed, we worked with the National Ministry of Education to incorporate our methodology into the national standards and programs. As our role ended at the end of 2020, Paraguay has hired our coordinator to continue implementing the project. In the words of Marian Wright Edelman, education is for improving the lives of others and for leaving your community and the world better than you found it. I think we've done that.
Indeed we have. Thank you, John. And if anyone would like to volunteer to give the reflection, it's easy. Siobhan has put the link in the chat, or you can email her directly. Before we go further, I want to extend a very warm welcome back to our Executive Director, Corinne de Torres, who is out on maternity leave. Corinne, we're so happy to see you. And at the same time, we want to extend our thanks to Siobhan for handling the office so well during your absence. Thank you, Siobhan. Now, although I don't see any guests, perhaps we have some, I would ask that Rotarians who have invited a guest to raise their real or virtual hand, and Maria will call on you to unmute and introduce them. Or if you're a visiting Rotarian who came on your own, please raise your hand and introduce yourself, or let us know of your presence via the chat box. Maria, do we have any guests today?
No, Ruth, I think you were right. We have a small but mighty group on this cold Tuesday. Back to you.
All right, well, thank you all for attending our meeting. And it's still February. I would like to extend a happy birthday to everyone with birthdays this month. Here is the list of February birthdays, and I was reading this morning that research by Harvard shows that babies born in February were both taller and stronger than other babies by age 7. So it was on the internet and it must be true. Of course, we all know that February people are very special and dear to our hearts. Thank you so much. Happy birthday. And please reach out to your fellow Rotarians. I'd also like to announce that the Rotary Club of Portland office is moving at the end of this month. This is part of our cost-saving measures. We sure could use a volunteer with a truck to take a load of items to Goodwill next week. If you're able to volunteer, please contact Corinne and offer this one little bit of service above self. Now please welcome Rotarian Susan Cooksey to tell you about our International Services Committee, the Committee of the Month. Susan?
Okay. Do you want to start the presentation? I'm going to tell you about a global grant. Oops, go back there you go. Tell you about a global grant that the Rotary Club of Portland is the founder of we are the international partner. It's a global grant. You can see the number up there. It's funded. I'll tell you about that more in just a minute. This is phase 1, providing clean water, water sanitation, hygiene education in SOEUR Kingdom of Cambodia. As you can see, that is the SOEUR school and our new water project. Is anybody laughing? I can't hear any laughing. Okay, no, obviously that is not. That is a picture of Angkor Wat. And I don't know how many people have been to Angkor Wat, but it's an absolutely marvelous place and very, very overwhelming to view. Okay, next. Okay, so the Global Grant team, the host sponsor is the Rotary Club of Sangay Battambang in Cambodia. And you can see the members of their sponsor club. And we are called the international sponsors. And you can see the 3 people that are the sponsors from our club. Next. Okay, these are 3 of the sponsors from the Rotary Club of Sangay Battambang. And Rith is the person on the far right, and he is the lead person. And in the background, you can see the SOEUR school, and looks wonderful. The SOEUR school was built by Golden Leaf Education Foundation. I know some of you are familiar with that. It's an organization founded by Keelong Ung, who used to be a member of our Rotary Club. And what he does is builds schools in rural Cambodia in memory of survivors of the Khmer Rouge and people that died under the hand of the Khmer Rouge. He was a person in one of the slave labor camps and obviously survived that for 3 years between the ages of 10 and 13. So what he does is build schools in rural Cambodia in hopes that education will decrease the possibility that another mass casualty will happen again under a dictator like Pol Pot. So this is one of the schools that he built. This is the one specifically in SOEUR. After he built the school, the leaders of the community got together with the people with Golden Leaf and said, gee, we think we have really bad water. Can you do anything about that? Well, Keelong asked me at a Rotary meeting if I could look at that. And I thought, how difficult can it be to set up a water system in SOEUR? Well, it was a challenge, needless to say. I was on a big learning curve from being a women's healthcare researcher and nurse practitioner to try to figure out water systems. So I jumped at the challenge and spent 5 years doing this, and it has finally come to fruition. Next. Okay, so who are the clubs that are supporting the funding? And you can see these are the 11 clubs that are supporting the funding. Next. What is the funding? The total funding is $101,834. The money from the Rotary clubs is $31,361. The district funds, that's from District 5100, are $27,396, and the World Fund is $43,000 plus. This is what's wonderful about global grant funding is that the money from our Rotary clubs is leveraged by the district and the World Funds. So that gets us up to the total of $101,834. Next. Okay, I apologize for the size of this. This is Cambodia, and the town of SOEUR is that red dot way up in the left-hand corner, and it is very close. There you go. Thank you. You can. It is close to the Thai border, and the Rotary Club of Battambang is just south of there and a little bit east. They're about 1 hour from SOEUR, so that makes it easy for them to get to do a lot of the project support. Next. This is the gateway to SOEUR. I think it looks very formal and obviously organized. Next. Okay, oh, sorry, this is out of focus. This shows the school and all of the kids in front of it. Very excited about the opening of their school. I don't have a picture of the preschool. I'll put that in the next time because it was air conditioned in that it was wooden and had lots of holes. So this is a vast improvement for the system. Next. Okay, we are doing a solar powered borehole water system built by Water Mission. Water Mission is an organization in Charleston, South Carolina, who has done a lot of work with Rotary before. And we tried to look at what is the best system for the people of SOEUR. Well, petrol was obviously an option, but a poor option just because of the cost of petrol. Fortunately, they are in an area of high solar use, so solar seems to be the cheapest way to do it. You can see these are two different options on how they build the system. You can see the solar power panels above the structure, and then the tank that holds the water in it behind it or on top. The particular configuration for the water system will be decided for each system, but these are two that they have put together. Next. Okay, this is what we will be distributing the water with. It comes with the grant, cute motorcycle, and they can put the jugs on the bottom and distribute it to the various households. A main part of all Rotary grants is sustainability. So how is this grant sustainable? What we will be doing is offering the water at a very low cost. Currently, the people in the village can buy 5 gallons of water for approximately 75 cents. We can produce 5 gallons of water for about 7 cents. So what the village will do will be put together a committee to set a rate to sell the water and make a little bit of profit so that they can replace parts that are broken or petrol for the motorcycle, etc. And so it'll make it as a sustainable project. Next. Each classroom will have clean water, and you can see this is a picture of the jugs in the local market and then the cups. And each student will have their own cup, and each classroom will have a jug that they can go fill with water and serve the students in the classes. Next. Okay, this is a picture of the kids hamming it up as kids do. I'm very, very excited about the funding of the project. First, I'd like to thank our Rotary Club for all of the money that you have given to the Rotary Foundation for grant projects. And I'd like to thank you for supporting it through our club. This was a phenomenal experience for me to make a difference. And thank you very much. That's it. Thank you.
Wonderful. Thank you, Susan. And I know from all the emails how tirelessly you have worked on this global grant, because the bureaucracy of working internationally is not for the faint of heart.
Thank you.
Now, we're going to disappear and enter a virtual table talk. Please introduce yourselves to the others in your group. A minute or so before you come back to this main meeting, you'll get a visual heads up. And in the spirit of international service, may I suggest a topic for your discussion? Have you met Rotarians around the world, or perhaps at international conventions, friendship or group study exchanges, other Rotary or non-Rotary events? Have you gone to a Rotary meeting in another country? Talk about it, and let's find out where we've all been. Here we go. And now on to our program. After our speaker today is finished, if you'd like to ask Tyler a question, Maria will moderate the Q&A through the chat box. Now, please welcome back Rotarian John White as today's chair of the day. John?
Good afternoon again. Our speaker today is Dr. Tyler TerMeer. He's Chief Executive Officer of the Cascade AIDS Project, the oldest and largest community-based provider of HIV services in Oregon and Southwest Washington, and PRISM Health, a safe, affirming, non-judgmental, federally qualified health center where all members of the lesbian, gay, bisexual, transgender, and queer community and beyond can obtain the compassionate and culturally effective primary and mental health care that they need and deserve. TerMeer graduated from Otterbein University with a BFA in theater design technology, fully intending a career in theater management. However, after testing positive for HIV in 2004 and experiencing the support and expertise of the local AIDS service organization, TerMeer turned his efforts towards helping others living with HIV and advocating for strong, effective HIV policy. Now headed into his 7th year at the helm of Cascade AIDS Project, TerMeer has led the agency through significant growth and evolution to best meet the needs of those living with HIV and AIDS. TerMeer is an avid cyclist and runner and lives in Portland, Oregon with his rescue dog, a pug named Riley. Dr. TerMeer.
Thanks so much, John, for that warm welcome. And hello to all of you listening in today. I'm honored to be here to talk a little bit about the organization that I sit at the helm at, Cascade AIDS Project, and our health program, PRISM Health. You know, CAP is an organization that started in the early 1980s in response to the HIV/AIDS epidemic as it began to hit the United States. With a group of amazing volunteers that came together to support people who were being impacted by a new disease. Folks gathered in living rooms and over their tears and terror and their conversation and cocktails, they formed the organization that we now know and love as CAP. Over the years, we started as a very small grassroots nonprofit and have evolved to become now one of Oregon's large nonprofit organizations. And I'm just very thrilled to be here today to tell you a little bit about who we are, how we got to today, and what the last year has looked like for us at CAP, given everything happening in the world. So this presentation is really centered around what it meant for us as an organization to return to the roots of our movement. We are 35 years old, celebrated our 35th anniversary at the end of 2020 on December 16th. Under the mission, we support and empower all people living with or affected by HIV, reduce stigma, and provide compassionate healthcare to the LGBTQ+ community and beyond. And over the course of our history, we have looked like many things, from a direct service provider of support groups, evolving later to offering behavioral interventions to help people prevent the transmission of HIV, offering HIV STI testing and screening to the community once that became available in the 90s, and then creating what became the bread and butter of our work over time, which is largely centered in addressing the housing needs of people living with HIV who are impacted by the housing crises happening here in Portland and across Oregon. A large part of our work really exists in kind of three separate buckets, as I like to think of it. The core of our work, which most people know us for, is the HIV STD screening services that we offer in Portland and the metro area. We're the only truly free access to HIV STI screening in town. What that means is that at other places, you may not pay out of pocket, but you certainly have to jump through the hoops of showing insurance, proving who you are, all of those things. At our site, we want it to be as low barrier as possible so that you are empowered to know your HIV status, and we can help curb the tide of HIV and STD infection in our state. Beyond that, we're helping people, regardless of their HIV status, get linked to insurance options like Medicaid and Medicare or the private marketplace. And we're ensuring that people know what tools are in the toolbox to ensure that they do not ever acquire HIV. Speaking of acquiring HIV, we've come such a long way in this epidemic. Did you know that now people who are living with HIV are living with a more long-term chronic illness than a death sentence? We know that people who have access to care and to ongoing treatment are virally suppressed, meaning that when we run their lab work every 3 to 6 months, that we no longer detect enough of the virus in their bloodstream to transmit the virus to other individuals. So in fact, we have a functional cure. If we could get everyone who needed access to treatment on treatment, consistent on that treatment, the virus would no longer be able to spread through our communities. But for a variety of reasons that prevent access to healthcare across our country, especially in the southern United States, we continue to face a large and growing HIV epidemic in our country, one that could easily be stopped with appropriate access to healthcare and medication. We also now live in a time where there's a pill that you can take every day, kind of like birth control, to help prevent HIV infection. It's a pill that we call PrEP, or pre-exposure prophylaxis. And that pill allows folks, when taken regularly, to build up the protection so that if they are potentially exposed to HIV, it will not enter their life in a significant way. This pill, unfortunately, does not prevent other STI infection, but can keep individuals safe from HIV acquisition when taken regularly. And then the last scope of our work is in healthcare. As the HIV epidemic grew up, so did we as an organization. And we really wanted to figure out what our pathway to sustainability may look like as an organization. In 2014, we began a long, comprehensive planning process to help us figure out how we would remain relevant with the shifting healthcare landscape around us. And ultimately, we landed on becoming a primary care and behavioral health clinic for the lesbian, gay, bisexual, transgender, and queer communities of Portland and beyond. We're so proud of our health center that's providing a safe, non-judgmental healthcare experience for LGBTQ+ folks all across Oregon who, for the first time, might be receiving care that they feel is safe and affirming to their sexual orientation or gender identity. Everything that I just described are amazing services that are produced by a team of about 125 folks across 4 offices, 2 here in Oregon, 2 in Washington State. Yes, we're now a dual state nonprofit that expanded into Southwest Washington in 2017 with offices now in Vancouver and Longview, Washington. But also everything I just described are services that are meant to be done in person in a client-centered, trauma-informed way. So a lot changed for us in 2020 when COVID-19 graced our presence. Our healthcare services, which are done in a compassionate way for LGBTQ+ folks, had to quickly find a way to pivot to virtual appointments. This was not something we were set up to do. And so in a 10-day period, we had to figure out how we would flip our entire in-person healthcare model to a virtual telehealth module with our care providers working from the safety of their homes. We're very proud that in that short amount of time, we were able to make that switch. I'm sure there were some bumps along the way, but we were able to continue to provide high quality care to our patients. That takes the form of primary care services, gender care services for those coming from the transgender community or who are identifying as non-binary or gender non-conforming, nurse consultation for the community who might need it, and referring folks out to other programs and services that we do not offer in-house, but want to ensure they have a smooth connection to other LGBTQ affirming services in our community, and that we are addressing the mental health needs of those from the LGBTQ plus experience. We also had to figure out what it meant to start offering COVID-19 specific services. And through virtual appointments, we can triage our calls to ensure that people have general information. We can answer questions about COVID-19, but also if folks fit the criteria, we can schedule an in-person appointment for access to testing and hopefully soon access to COVID-19 vaccine. Obviously, all healthcare cannot be done in a virtual space. And so we did remain open throughout 2020 by appointment only. And during that time, we were offering COVID-19 testing to the community and a variety of lab services that could not be delayed during the pandemic. Those included lab services for gender care, for those who were newly diagnosed with HIV, those who needed sexual health screening and treatment. As I mentioned earlier, our healthcare practice is only one piece of our work. And so we also needed to figure out quickly what it meant for our HIV Social Services in Oregon and in Southwest Washington. Those services flipped to predominantly telework, having our staff continue their work from the safety of their homes via the phone, email, or virtual appointments, just like this Zoom platform that we're using today. And we were able to maintain our housing and medical case management and other navigation services through that virtual environment, continue to provide a service to the community that assisted with emergency rental assistance. With the impact on our economy and a lot of folks losing their work, we were able to provide additional emergency rent assistance to people living with HIV to maintain a safe roof over their home during this time. For those who are on our waiting list to receive housing, which at this point is more than 350 individuals living with HIV, we were able to get those who were most medically vulnerable off the street and into medical motels during the peak of the pandemic, and continue to look for ways to refer them to shelters to ensure that they're ready for housing options as they present themselves, and to offer services in a supportive way, like peer support specialists who are other people living with HIV on our staff to support them through their journey in social service while they're awaiting housing stability in their lives. And finally, that we have a set of culturally specific HIV service navigation available for those in the Latinx community and those who identify as Black or African American that we serve. In order to recognize that not everyone that we serve would be able to reach us via the internet or via the phone. Many of the clients we serve do not have access to those things in a regular way, and their main point of access to us was the public library or other systems that also closed during the pandemic. We figured out a way to reopen our in-person services 2 days a week, Tuesdays and Thursdays, to provide on-the-ground efforts. That meant a triage center to get people a tarp or a tent that might be living outside, but it also meant finding new ways to address new emerging needs during the pandemic, which for us rose to the top was addressing food insecurity of those living with HIV. We formed a brand new partnership with Our House of Portland, a HIV residential care facility in town, who also runs a food pantry for people living with HIV, and have been delivering food boxes every Wednesday to folks who are living with or affected by HIV in the metro area. That's anywhere between 65 to 80 food boxes per week to individuals who don't otherwise have access to food during the pandemic and can't make their way from their home to a food pantry. Those food boxes have also acted as a vehicle for our staff to ensure that folks who are unable to leave their homes during the pandemic have access to medication, to cleaning supplies, and other essential resources that they might need in their home, and has provided us another vehicle to get bus passes, preloaded mobile phones, and urgent intake materials out to folks so that they can stay consistent in the services that we provide. And while all of those things have been an opportunity for us to create innovative new ways of delivering service, we also needed to find ways to create socially distant virtual appointments out in the community. So that means meeting in a park, outside a coffee shop where we can get someone a warm drink, or in any space in the open air where we can still see our clients from a safe distance and make sure that they're okay. Obviously, this has also impacted who we are operationally as an organization. So just quickly, the more boring side of things, for some folks, we've had to figure out how to maintain skeleton crews for our ops and IT teams, which has really ramped up their work during the pandemic to ensure that our staff have everything they need to operate safely from their homes. And the same for our finance team to ensure that payroll still happens, that we're still getting rent checks out for all of the clients that we pay for their rent monthly, and that we're reporting to the board and our community about the sustainability of our organization during the global pandemic, both financially and operationally. That, of course, meant several new investments in the organization to make sure that we had the appropriate equipment in the hands of our staff, that we had the appropriate telehealth modules for folks to be able to provide their services from home, channels like Zoom or Slack so that we could continue to communicate in a smooth way during the pandemic, and increased security so that folks could operate in this space with confidential protected health information, and ensure that our community felt safe with our ability to continue our services. And in the areas of human resources, it obviously meant that we had to quickly switch a new lever of finding out what new leave options needed to be available for our staff. We are a nonprofit, but we are a union nonprofit. And so we had a lot of negotiations with the union about what it meant to be an environment that stayed center on our mission of delivering in-person services, but kept everyone safe and healthy during the pandemic. And it meant finding new ways of hiring, onboarding, training, things that I'm sure everyone is experiencing in their day-to-day lives, in the places you work or with your family and friends that are working during this time. Many new policies went into place, and I'm proud to say that we've been operating our agency at about 90% of what we would normally offer out of the pandemic throughout the last year, and are hoping to continue to scale up those services in the months ahead. We're able to do that because as an essential service provider, our staff qualify under 1A of the COVID-19 vaccination protocols, and very gratefully, we all received our second dose of vaccination this past weekend, and are looking forward to being able to share in community with those we serve very soon. In order to prepare for that, we've really been monitoring culture, ensuring that our staff feel appreciated through gift cards, through finding ways to be together in the best ways we can in this virtual time and space. And then finally, just wanted to touch on what it meant to engage our community during this time. Obviously, the best way for us to keep people informed is to do big flashy events and to bring people together in large ballrooms and have just a good old party. But unfortunately, COVID-19 changed a lot of that for us. So we needed to find new ways to engage and communicate. We've been doing regular updates of who we are and how we're doing via our social media platforms and via our website and via our newly formatted virtual fundraising platforms. But we've also recognized that we needed to engage community in new ways. So I really looked to my executive team internally to start managing at the highest levels of their job descriptions, to manage the internal culture and to come to me when there were large decisions that needed to be made so that I could spend more time being an external face and voice for our community and those we serve during this time. That has meant my stepping up in a new capacity, in addition to being the CEO of Cascade AIDS Project, to being the LGBTQ plus liaison in the Multnomah County response to COVID-19 to ensure that the voices and concerns of people in our community are heard during that process of rollout of COVID testing, as well as vaccination plans for the community. And have joined and been appointed to 2 of the governor's councils, one on healthy early learners and advising on what happens to schools during reopening and students during a period of closure, representing both LGBTQ plus students, as well as those from Black and Indigenous and other people of color communities. And then also serving as a racial justice health equity committee member of the Governor's Council to ensure that people living with HIV were prioritized as a community to receive vaccination once we receive the community vaccination level, which we're hoping will happen in the months ahead. It's also meant really figuring out how we can be innovative through finding ways for people to help us continue to raise money during this time of virtual get-togethers. So we've done everything from virtual happy hours to fun, engaging events on Zoom and other social platforms. We've really leaned into our existing funders to ask for flexibility, to foundations to ask for support to keep us going during this time. And of course, to our amazing individual and major donors who care for us so much during normal times, but especially during this pandemic. You know, people living with HIV survived one pandemic early on in the 1980s, and they did so with a lot of resilience. And I think now we are faced with a second pandemic, and they certainly don't want this to be the one that takes the toll on their community. And so they're counting on organizations like CAP and Prism Health to continue to be there for them through the darkest of times. And that has been our role, to be the light in the dark by figuring out how to shift and to adapt as an organization, and to find ways for social distance, but not to cut people off from social connection. So I appreciate everyone's time today so much, and I'm happy to take any questions that folks may have.
Tyler, thank you so much. I'm going to be leading our Q&A portion. Just as a reminder, Rotarians, if you do have a question, please raise your electronic blue hand or shoot me a note in the chat for getting into the queue. Tyler, I'm going to kick off with a question. You mentioned a lot of things you're having to do differently because of the pandemic. Tell me about 1 or 2 things that you want to keep that you've done and changed as you move forward. Have there been things that you're like, I want to make sure that we don't lose this, what you may have learned during the pandemic?
Yeah, you know, the 2 things that come to mind immediately are we now do our all staff meetings virtually via this Zoom space. And previously we were trying to get people from 4 different offices all in one space, some of which were driving from Longview, Washington to Portland for a meeting, and it was wasting an entire day for some folks by the time they got here and got back. So I'm really excited about the access to these new virtual platforms and figuring out how we create new hybrid models for meetings and events to allow more people to gain access to information or to meetings without having all of that drive time in between. But I think programmatically, the ability for us to meet people where they're at, to drive to their home, to get them resources that they need, especially food and access to vouchers for transportation, has been huge for our community. A lot of them have significant barriers to that in and out of the pandemic. I think something we've really learned in the social service community during the pandemic is that the issues that we're seeing now are not new. They're just issues that are being exacerbated by the current pandemic with more eyes on what's happening in our community. And so we really look forward to figuring out how some of these innovative new projects like food delivery or having the ability to meet people out in their community at a park or a coffee shop rather than having them make the trek into downtown Portland will change the way we deliver service.
Excellent, thank you. Our next question comes from past president, Rotarian Kate Ertman. Kate?
Thank you, Maria, and thank you so much, Tyler, for being here today. My question actually is not pandemic related, but as you were talking, I was realizing that maybe for folks who don't have someone in their life who is HIV positive, that they may not know how much things have changed in the past 30 years and how it is not, well, as it would be, of course, in the 80s, death sentence, and now treatment has progressed so well. So could you give some language, or maybe, I don't know, I'm a data person, so maybe top data points of when you're in a group, and I'll have people ask me, how is so-and-so, and I'll say how positive things, I never know like how much better it is or how much more survivable it is, if this makes any sense.
Yeah. So the majority of people now who are living with HIV, if they have access to regular ongoing care and treatment, are living a near normal life expectancy. They are actually not more susceptible necessarily to other disease. So we thought for sure that people living with HIV would be more susceptible to COVID-19 because of their weakened immune system. What we've learned is that, in fact, people who are living with HIV who take their medication regularly are not more likely to get COVID than those who do not have HIV. However, if you are living with HIV and you do get COVID, you're more likely to be hospitalized and have severe illness. So we're learning a lot as time goes on, but I think the short answer is just that, I do this activity sometimes with folks where I give them a blank. You can buy these like blank puzzles on Amazon. And I have folks, color and design all of these pieces that I hand them in a Ziploc bag, and they put the puzzle together and they realize that there's one piece missing. And on that piece, which I removed, is HIV. And the reason I do that is because HIV now is just one of the smallest pieces of the puzzle for the clients that we serve. I'm dealing right now with clients who are suffering from extreme homelessness, from other poverty, from food insecurity, and other disease that's impacting their life. And HIV is often one of the smallest things that they're trying to manage because they know they can live a long and healthy life with their medication.
Thank you, Tyler. Our last question actually comes from our current president, so I'll hand it over to Ruth. Ruth?
Wonderful.
Thank you, Maria, and Tyler, thank you for a really informative presentation. I was impressed that Cascade AIDS Project has been going strong for 35 years, which is a generation. Yeah. And I was curious if you intentionally connect those people who became HIV positive in the 80s with those who are getting the disease now, so that there's some intergenerational sharing in terms of how the situation has changed, but also to provide some historical context of how the pandemic began.
Yeah, that's a great question. We have several support spaces, many of which have created very intentional intergenerational conversation. As you're talking about, we used to actually have a specific group that was around intergenerational dialogue prior to the pandemic. But we've also created some pretty specific spaces for our long-term survivors, especially during this time where they're often triggered by a new pandemic. We launched a new program in the last couple of years called Aging Well. And Aging Well is a program that brings together long-term survivors, whether that's someone living with HIV that survived the 80s or someone who lost those near and dear to them, who also feels as though they are a survivor of a very tough period of their life where they lost a generation of their peers. That group is all the more important because as the epidemic is becoming more of a long-term illness, we now know that in the United States, more than 50% of people living with HIV are over the age of 55. So people are surviving, and news alert, people older than 55 still have sex. And so people over 55 are still contracting HIV and other STDs. I know it's a shock for some people, but it still happens pretty regularly. And so we're working to create opportunities to bring folks together in whatever ways we can during the pandemic, but are also super open to hearing from the community about what we can do to best support people living with or affected by this disease.
Thank you. Thank you so much. And thanks to all of you for showing up today. Next week, we'll hear from Lake Oswego past president, Alan Bazaz, with his personal story, along with his endeavors to do projects worldwide. This meeting will once again be live via Zoom at noon on Tuesday. And please make an extra effort to attend next week. We'll be electing our new club board members, and we really need a quorum. And so if you have friends that you want to reach out to now and say, please, I'll see you at Tuesday's meeting, it would help us a lot. I want to thank everyone who showed up today. And John, thank you for your reflection and your speaker introduction. Susan, thank you for your insight into our International Service Committee. Both reading education and clean water are so basic, we tend to take them for granted. But both your reflection and International Service Committee presentation today underscored how fortunate we are and should never take those basics for granted, as well as how we as Rotarians can reach out and help provide those basics for others. Tyler, thank you again for your informative presentation. I was just struck by how compassionate the Cascades AIDS Project is and how quickly you were able to adapt during the pandemic to continue offering services. Congratulations on a job well done, and best wishes to you and CAP for continuing that essential service. And now, as we enter into a new Rotary Week, please join me in opening the doors of opportunity for healing, for recovery, and for peace building. As Rotarians, we're here to make our world healthier, more sustainable, and with justice for all. Have a good week, everyone. Thank you again for coming. And this meeting is adjourned.